The broadcast is now starting. All attendees are in listen-only mode.
Welcome, everybody. Welcome. We're just slowly getting started. Hi, I'm Jennifer Rakes. I'm the Executive Director of the Trichotillomania Learning Center. I am delighted that you've joined us today for a very special series of our monthly webinar program. This is a special three-part series that we're co-hosting with the Canadian BFRB Support Network, CBSN. And I'm thrilled that Sarah Robertson is with us today to be our speaker. Sarah, for those who can see our webcams, we're waving hello. And Sarah is the founder of CBSN, and she is a social worker in her own career. She is a woman who has trichotillomania, as do I. So we are speaking to you from with both some personal experience and professional experience in this field. I want to just start out by letting you all know some of the logistics of how this webinar will work. We definitely want it to be interactive, but unfortunately we cannot hear or see you. You can hear and see us, but we can't hear or see you because, of course, that would be a little chaotic with a lot of people on a webinar. So the way that that this will be interactive today is Sarah's going to give a talk, and she's going to there's a PowerPoint that she'll be going through so that you can see some, reinforce what she's saying with some visuals. And on your little control panel that you should be seeing there on the side of your screen, there is a tab that says questions. And that is the tab where if you have any questions that you'd like Sarah to answer, and you can do this at any point in the talk, just type your question in. And if there's something that seems urgent, then we might interrupt and ask questions. But if it's not, then what we'll do is we'll get through everything she was planning to present, and then I will field your questions to I will read them basically to Sarah at the end. So please do submit your questions whenever you think of something that you want more clarification on, and we look forward to enriching the discussion with your questions. Now, without further ado, I will let Sarah take it away.
All right. Well, good afternoon or good evening, depending on which time zone you are in. So my name is Sarah Robertson, and I'm the founder of Canadian BFRB Support Network. Many of you may or may not know who we are. We're basically the Canadian equivalent of TLC, and they've helped shape us to who we are today, and they've supported us from the very beginning. I myself have had trich since I was 12. I developed it, I pulled from mainly my scalp, and I stopped for 10 years. I couldn't tell you how I did it if I tried, but I then began maybe a couple years ago, and for me, I really needed to meet somebody who also had a BFRB. It was really important to me because at 20, 22 or 23 years old, I had never met anybody else who pulled their hair out or who understood exactly what it was I was going through. So initially, CBSN was basically a way of me looking for somebody to talk to. So it started out as a peer support group in Toronto, and from there it just grew to what we have today, which is a nonprofit organization. And we have all sorts of support groups across Canada. We offer online support as well to those who cannot attend in person. So I'm just going to go down, I guess, to the schedule of what we're going to be going over today, which is in the slide 4. And so what is peer support? We'll be talking about that, why you should start a group, the benefits of starting a group for your own recovery and overall awareness. And if you live in a remote or rural area, somewhere that is not, accessible to mental health services, or it's just not, you're not feasible to head into your own support group in your province or state, then we'll be teaching you ways that you can also find support, and even give support to other people. And logistics, so we'll just be going over what some of the issues you might face trying to start your support group, which would include finding a location, how you want to run your group, et cetera, et cetera. Promoting your group, so that's something that TLC and CBSN will both do to help you. That's why we're here. And then finally, we'll do a Q&A. I know a lot of people will have questions, especially parents. At the TLC conference this year, I got to sit on a parenting panel, and I know the parents just asked tons of questions. So I'm looking forward to hearing if you guys have any comments, concerns, or suggestions if you run your own support group right now. All right, so if we move on to the next slide, you'll just see I love sayings about peer support. So you'll find that peer support is really all about community. So any one of us could be affected by an unexpected life event or illness where peer support will be vital to our recovery and well-being. So I just love looking at quotes for peer support because it's vital. I find, especially in the BFRB community with limited resources and stuff that we don't always have access to. So moving on, what is peer support? So peer support can be defined as a relationship between a group of people or individuals who have a common experience, which can often be an illness, cancer patients, mental health issues, all sorts, diabetes. There's tons of support groups out there. So the peer support is built on shared experiences and empathy, and it focuses on individual strengths and working towards recovery and your overall well-being. Peer support can be done virtually, like we are doing right now. It can be done in person, one-on-one groups. It depends really how you want to start your own support group. And basically, peer support provides opportunities where people can learn new skills and how to improve their situation, whatever it is they're dealing with. So why should you start a group? This is basically how CBSN started for me. I had never met anyone in 22 years who pulled their hair, and I wanted to meet someone so desperately. So that's why I decided to start a group. I was tired of not having access to somebody who could help me, or somebody who could understand me, what I was dealing with, and I just needed to meet someone. That's basically what it was. So starting a group, anyone with a BFRB knows that living with one can be really lonely, confusing, frustrating, and many of us have been or are still stuck in the closet, so to say. We haven't told our parents or family or friends. We're still, hiding under a rock. But by hiding these disorders, I feel like it almost makes it worse for us because we're isolating ourselves. And, we've dealt with judgment, feeling lonely, scared, and confused. And it doesn't help that, even doctors, even medical professionals don't understand exactly what it is we're dealing with. Oftentimes I hear people say, I went to my family doctor looking for help or support, and they had no idea what it was that I was doing. They told me to just stop it. They gave me antidepressants to, try and help me, but that's just not, I guess, for me personally, that's just not something that helped me while I was trying to find support for dealing with trichotillomania. So starting a group can be extremely empowering. I cannot even explain to you how it feels once you start a group. You get this huge sense of relief, and you're just so empowered, you're ready to take on the world. So starting a group, it's also a great way to reduce the stigma surrounding BFRBs and overall, reducing the stigma about the conditions, and it's a way to bring us together to share our experiences. Another huge reason why I like peer support is it alleviates the wait times in the healthcare system. So if any of you have tried, here in Toronto specifically, there is Sunnybrook Hospital offers. It's basically a CBT-run peer support group for skin picking and hair pulling. The wait list for that used to be a year to 2 years. So while you're waiting for that, like you're really struggling, and I find peer support is what kind of fills the cracks in between waiting for professional help, whether it be seeing a psychiatrist, a social worker, anyone like that. So I find that peer support does fill in, and it teaches coping skills. You get to meet people with the conditions, and you're raising awareness at the same time. Meeting someone else, it's such an amazing feeling. I can't even tell you what it feels like to not ever have known somebody with a BFRB before. I was like, I'm the only person in the entire world. Why is nobody else, dealing with this? I feel like I'm literally the only person in the world. I can't even remember what that feels like now, because I've met thousands of people within the past couple of years, and it's just like, they become my friends, and it's not abnormal anymore to hear people coming up to me, even strangers, saying, oh, I've seen some of the things you've done, or they're contacting me via email and whatnot. It's just so empowering. And I guess mainly starting a group is because, do you have a treatment provider who treats BFRBs around your area? Most likely, most people do not, especially in Canada. Here we have about maybe 6 treatment providers, 3 of which are in Toronto, 1 in Calgary, 1 in Nova Scotia. Like, it's very limited. So creating your own kind of support system and resources is really, it's phenomenal. It's what's going to get, doctors and treatment providers and mental health clinicians starting to look at these conditions and saying, yeah, people actually do have, these, and they do need help. So that's one definite reason to start a support group. And lastly, you want to start a support group for yourself or your child. So I know a lot of parents want to start a support group for their child because they're just, they don't know what to do anymore, and they really want to connect either with other parents or have their child meet somebody else and see that it's okay, that they're not the only person in the world. So for me, CBSN started as basically me being selfish and wanting to meet another person who pulled their hair as well. So moving on from that, we will go to the next one. So why do you want to give back? What is it that what made you attend this webinar tonight? So basically, why do you want to start a support group? For me, if you look in the picture there, I don't know if you could see it, but there's a small child somewhere on there. Anyways, I wanted to prevent any young person from feeling the way I did when I was 12 years old. If we can prevent bullying, if we can educate teachers, principals, social workers, anybody, then we've done a good job. And that's ultimately the goal, I guess, of peer support, providing awareness and support and letting other people know that they're not alone. That's really the basis of it. So benefits of peer support, to me, they're endless. There's just so many. These are just a few that I came up with. So whenever you have a peer support group, it's a safe environment. It's a safe space where you can ask questions. There's never any stupid questions, okay? Like, people have talked about, do you also eat the tip of the hair? Like, do you eat the root? And if you said that to somebody who didn't have a BFRB, they might look at you and say, oh my gosh, what are they talking about? But in a peer support group for BFRBs, you can talk about what it feels like to pick your skin, what are the repercussions, what's going on, and what are some of your concerns. So it's really a safe space where you can be yourself and ask whatever you want. It's also a great place where people share information, whether it be educational or they give you tips and tricks on how they deal with something that affects their BFRB. So for example, I know in some of our groups we talk about some of the products we really like. Even for skin picking, for guys, there's not a lot of products that we can recommend, but we always talk about bath bombs from Lush, moisturizers. Like, we just talk about anything that has to do with, I guess, the topic of discussion at the support group. So there's always something to walk away with. You're always learning something, you're always trying something different, and it's awesome. Also, the main reason for me was, like I said, it was to reduce isolation and to meet new people and somebody who knew exactly what it was I was going through. They understood me without having to explain myself fully. And going to a support group, it increases your self-esteem. It sheds a light at the end of the tunnel. You can see that there's hope. In my specific support group, when people started attending, there was 3 people that I can specifically think of. They were so ashamed of their condition. They said, I'm never telling anybody about this. I don't care. I'm not telling my husband. I'm not telling my best friend. And a few years later, they are very outspoken advocates on social media. So it's been incredible to see the changes people go through after attending a support group. And next up, so you'll see this is a group of CBSN Toronto members. That's at a TLC event that we had last year or the year before. I can't even remember. It's been so long. So most of these people in this group I am still very close with. There's actually 2 members in that picture who attended the very first support meeting I ever held, which was in my house, and there was 4 girls, including myself, and I'm still in touch with 2 of them. So it's pretty amazing. These people have become lifelong friends, and it goes beyond the BFRB. They're there for you whenever you need them. So other benefits, realizing that you're not alone in this struggle with having a BFRB. Like I said, their outlook on BFRBs has changed since coming to a support group. You could just see the difference. More people have accepted, I guess, what it is they're dealing with. They're learning coping mechanisms. It's amazing. And, going to a peer support meeting, you're getting the support that you might be missing from family and friends who have no idea what it is you're dealing with. Most of our parents or friends are like, if they see your hand going to pick your face or pull a strand of hair, they go, stop it, just stop it, what are you doing? So they don't understand what it is that we're actually doing. But when you go to a peer support group and you talk about all these things, these people get it. They don't need to you don't need to explain the ins and outs. They fully know what you're talking about. Peer support also gives you control over how you see your treatment going, which direction you want to take it in. So, some people accept their BFRB while other people are still not accepting of it. They want to find a way to stop, and that's totally fine. So a peer support group has a mixture of people. You'll find people who are totally designated. They're there just to find a purpose to stop the picking or pulling or nail biting or whatever it may be. And then there's other people who are there who just want to see another human being who has these conditions, and they're accepting of it, and they're teaching others ways that they've come to accept it. And then there's also people who have fully recovered. We have people in our group who came to the group who did not pull or pick. They may have started again, but then there's also people who were pulling and picking, pretty severe, and now they have reduced their picking or pulling. So, I mean, there's all different types of stories, and nobody's on the same page. We're all at different levels, I guess, in our recovery process. And last but not least, it's free. Like, that's pretty awesome. It's free. You don't have to pay to go to a support group. Most of them you don't have to. None of the ones CBSN does charges. I know there are some groups in the States that do charge, but typically it's free, and it's helping you, so that's awesome. So next up, we're going to be talking about how you can find support for yourself or provide support for other people if you're living in, like I said, a small town and you don't know anybody else, or you don't think there's anybody who you could reach out to start a support group. So like what we're doing right now, you can host a virtual peer support meeting if you wanted. It's almost like setting up the same, if you were going to do an in-person support group, you're going to do the same background work, you're going to do all those things leading up to the group, but it's just going to be virtually. So some of the free some of the free, I guess, tools you can use are Skype or Google Hangouts. I know Google Hangouts allows up to 10 free webcams joining together, so that's a really great option. Also, I know many of you are in Facebook groups right now. Facebook groups they're not for everyone, I'll say that. Some find them really rewarding and other people find them really frustrating. So Facebook groups, if you go onto Facebook, if you have Facebook, and you type in the search bar, Trichotillomania, hair pulling, skin picking, you'll see a list of various groups. Now, there's either open, which means people can see what you write in the group, and they can see who's in the group. There's closed groups, which is most of the BFRB support groups. So nobody can see what you write. No, your family, your friends, nobody can see what it is you're discussing. You have to be approved by an administrator to join the group. So they tend to do their background work and seeing if you actually have a BFRB before they allow you to join. So there's tons of groups. There's groups for nail biting, skin picking, hair pulling, parents of kids who pull their hair and parents of kids who pick their skin. There's so many options, so that's a great resource that you can look to for peer support. And you can always connect with other people on social media outlets such as Twitter, Tumblr, Facebook, Instagram. I know Tumblr is huge in the BFRB community. You can be anonymous so nobody knows who you are, but you can share so much information with other people, and you can advocate from the comfort of your own home without having to, give away your identity. So this is something that I really recommend, even if you're not looking to start a support group or you just want to advocate for BFRBs. Being anonymous on the internet can be very, very cool because you can do such great things without anybody knowing your name or knowing where you live. You could still spread awareness and you can make a difference. So as long as you're talking about BFRBs, you're definitely making a difference in the community. And so lastly, if you reach out to a mental health agency, so depending on your town or city or wherever you are, if you can reach out to somebody, I know here in Canada there's the Canadian Mental Health Association. They have chapters across Canada, and they're usually in the main cities or towns of our provinces. They can actually help set up a support group. We have one member who's currently starting a support group with them assisting her. So look if there is any mental health agencies who would be willing to help you start a support group, or you can just ask them, do you have any clients who pull their hair or pick their skin, because I'm someone who does this and I would really love to meet up with another person. More often than not, they will definitely be interested in helping you out. All right, so moving on. So finding a space to hold a support group. Now, this is probably one of the most challenging things you'll have to do at the beginning. Most space is not free, but it is doable. So when I say find a free location, use it to your advantage that TLC and CBSN are nonprofit organizations. I've put together a template, which is a letter that you can give to whoever you're looking at the space for. So whether it be your local church, a civic center, a community center, you can give them this letter, and it just makes you that much more legit. I know some spaces actually ask for an organization's charitable number or nonprofit number so that you would get the location for free. So I will send that out along with a few other things. But where to look? So church basements, regardless if you're religious or not, this is a great place to look. Typically it's in a basement, it's in a room where there's no religious anything happening around that sort of thing. It's usually like on a weekday night. I know Al-Anon and AA, they hold meetings there. I know Boy Scouts, Girl Guides, they hold meetings in church basements all the time. It's just free and it's accessible. Libraries, I know in Canada some libraries charge to use the community rooms, but others don't. So take a look at your local library. Civic centers, so for us that is like our local Toronto counselors are, so even if you go to your local town hall, you can ask them if they know anywhere, if they can provide free space to host a support meeting. Also, if you have connections to someone who happens to have a boardroom or a private office, that would be great. They can also provide that space. And lastly, we do not recommend using your home. We do not. I'm putting it out there. I mean, ideally, this is not what you want to do. I started CBSN and I started my support group in my home. Luckily, it was great, but you just never know who's going to show up. So that's a concern. So we don't recommend that you do that. And moving on. So scheduling. Because you're starting the support group, it's up to you. It's not up to anybody else, because at the beginning you're going to be the one who is trying to get things going, trying to get people together, trying to make people aware of what you are doing. So pick a time and a day that works for you. So for me, Tuesday nights seemed to be free, and there was nothing going on, so I chose that. And I didn't want to pick something that was close to after school or after work, so I chose after dinner hour. That seemed, so our time is 7:30 to about 9 o'clock. Sometimes it goes past 9 o'clock. It could go to 9:30, and even then, some people want to stay and talk, and it could last for hours. But what you want to do is pick a time that works for you, because you're going to be the one in charge for the first little bit. And so what you're going to want to do is also pick whether you're going to host your support group bi-weekly, so twice a month, monthly, or every other month, etc., etc. We in the Toronto group have been doing it every other week on Tuesdays from 7:30 to 9:30. That seems to be working, but in the summer you'll notice that there's a slower, I guess, attendance because people are out and away. So I think we're gonna go try once a month from now. Sometimes not everyone can make it, and you can't accommodate everybody. So I mean, what we used to do was also rotate between one weekday, and then 2 weeks later we'd pick either a Sunday afternoon. So that gave people an opportunity to come out and be able to at least attend one out of the 2 meetings that month. And how long should the meeting be? So I know some people host meetings for an hour, some people host them for 2 hours, whatever you're comfortable with, because depending on how many people show up, if there's 2 to 3 people, you might, the first time, definitely, trust me, you'll have, you won't have any pauses in between. You want to talk to this person or the other people for the whole afternoon. But when things start slowing down, it can be difficult to keep the conversation going. Don't worry, because that's normal. So you could also shorten the meeting if you feel like, it's not going anywhere after a while. You've done what you had to do for that week. So for me, an hour and a half or an hour seems realistic, because sometimes, like I said, it could go past 2 hours, and we have to stop it in Toronto. But I know other groups who do like a half an hour. It works, whatever. As long as you're meeting with someone, that's awesome. Moving on. So the format on how to run your support group. There are so many options. So what I do is I'm the facilitator of the Toronto group. So at the end of this presentation, you'll see we're going to send, TLC will be sending out a peer support package that we've put together. It lists everything you need to do, and it goes in depth on how to start your own support group. So our group is led by solely the peers. There's nobody there. It's mainly me in charge of the time, but the people who attend run the group. They're in charge of the conversation. We're not therapists, we're not doctors, we're not there to diagnose anybody. We're just there to support one another and talk and keep the conversation going. So peer-led versus therapist-led, they're much different. Peer support, people tend to open up more rather than in front of a doctor. People who know what you've been going through, that's when you'll open up a bit more. So having a therapist to lead the group, though, if you're not confident, in your ability to run a group or lead a group, then having the help of someone in the mental health profession is great. So if you yourself attend, if you go to a psychiatrist, or if you have a social worker or someone you think would be awesome at running a support group, then approach them and ask them if they would help you co-facilitate or even facilitate your support meeting. Otherwise, the other formats you'll have to think about are, is it going to be an adult-only group? Are you going to open this up to, the lines are blurred. So an adult, what do you consider an adult? Is it 15 and over? What if they're 14? Do you let them come in? Children, how do you feel about having kids in the group? Personally, with the Toronto group, we've never had somebody younger than the age of 13 attend. So I know parents are desperate to get support groups going for their kids, which is great. So I think if you promote it as for children, a BFRB support group for children and parents, that would be ideal. Typically, the Toronto group, like I said, it's adults only. We do have some younger people who do attend. There are teenagers, but it goes up to 70 years old. So depending on who's there at the meeting, the topics can change. I mean, if you have no teenagers and you're like 20 and up or 18 and up, it doesn't matter. Sometimes we might talk about more intimate things such as sexual relations with a BFRB. So that's a little bit more, adult content, whereas if a 14-year-old is there, we might tone it down a bit. So you're going to need to take that into consideration. Also, open versus closed. So at the beginning, our support group was closed, meaning only the person affected by the BFRB could attend. We didn't want spouses, parents, friends, anybody like that coming in and sitting in on a meeting, because so many of us were embarrassed to talk about our BFRB in front of other people. Now we've loosened, I guess, the purse strings, so to speak, that we let everyone who is affected by a BFRB attend a support meeting. So that goes for parents, spouses, boyfriends, girlfriends, friends. If you need someone to come and support you while you're attending a support group, that's totally fine. Most of us have anxiety, so if having another person there will help you go to the group, then bring someone. And then lastly, there's the 12-step program, which is based off of Alcoholics Anonymous. TLC actually has an entire page on their website dedicated to how you can run a BFRB 12-step program. So I will also ask TLC to send that to you tomorrow, along with some other things. So moving on. So taking care of yourself. So I suggest finding someone to co-lead the group with you. If you don't find somebody else right away who has a BFRB, maybe it could be your best friend, just someone to be there with you for safety reasons, for just emergencies, I guess, so to speak. After a while, once your group is running smoothly, then you can pick someone who is a familiar face who attends regularly. They can help you if you need to take a week off or you're going on vacation. You just need to find a reliable person to fill in for you. If you're feeling overwhelmed, sometimes support groups are not for everyone. Take the time off. You don't have to be Superwoman or Superman. Take care of yourself. Also, debriefing with other peer support leaders or even CBSN and TLC in general. You can ask us for ideas, or if you have concerns, we can help you figure out ways that you can improve things for your group. And lastly, remember why you started this group, because what is it that you wanted to get out of it? Just remember the end goal. Did you want to meet other people? Did you want to provide support for children? What is it that made you start this group? And also, Leslie from TLC, I know she set up a secret BFRB support leaders group, and if you want to join that group, it's for all support leaders for BFRBs, any support group. If you want to join that group, what I'm going to ask you to do, at the end you'll find my email. If you can email me and just say you want to join that group, I'll have to invite you by email. It's on Facebook, so it's not an open group, it's actually secret, so you have to be invited. So if you want to join that, just send me an email. So lastly, getting the word out about your support group. This makes or breaks your group. You have to work really hard to get the word out, and CBSN and TLC are here to help you. We have the followers, we have, the people who listen to us, so we have the means to help get the word out there for you. We can put it on our website, we can share on social media, but what you're going to want to do is set up your own email. That's definitely something you're going to need to do, and I recommend connecting it with your phone because so many people forget that they set up an email, and then people might be, asking for support and you forgot about it. So setting it up to your phone is great. Once you're ready, set a date and just go with it. If nobody shows up, that's totally fine. Even if one person shows up, that one other person needs support. So it's always a support group regardless of how many people show up. So social media, like I said, get on Twitter, get on Facebook, start a group for your area. We always recommend something like using your town and then BFRB. So for Toronto, it's Toronto BFRB at whatever.com, or if it's Montreal, it's Montreal BFRB at so-and-so.com for emails. So that's always something you need to think about. And like I said, if you look to your local mental health agencies, they can help promote your group as well. Moving on, so do something today your future self will thank you for. Starting a peer support group was the best decision I have ever made in my life for myself. I took control over my BFRB and it's been amazing. I haven't looked back since. So before we start the Q&A, I just want to let you guys know that there's 2 more parts to this webinar series. So the next part is how to raise awareness about BFRBs and advocate from the comfort of your own home. We'll be discussing group topics for peer support groups, having guest speakers at your support groups, and partnering with other agencies. So that's going to be part 2. Part 3 is group maintenance of a support group. So we'll talk about attendance issues, scenarios, certain situations that might arise in a support group, communication amongst members, different ways that you can keep the group running, whether it be using a timer or, what can you do to keep the group flowing. And then ways that you can also kickstart your group, how to get attention and how to get more people following you. So now I'm going to open it up to Q&A. So Jen will be running that. So if you have a suggestion, a comment, a concern, anything you want to ask, both me and Jen are happy to answer away for you, and we'll do our best to give you a great answer.
Great. And just to remind you all, hi, I'm Jen, in case you logged on late. I'm Jen Rakes, the Executive Director of TLC. If you do have a question, the way to share that with us is to go to your control panel, and there's a tab that says questions, and you can type in your questions there. And I'm sure you must have questions because it's a big topic starting a support group. In the meantime, I'll just mention, so, like Sarah, I really valued the group that I was a part of. I started with some other women, a support group in New York City that I ran for 10 years. And though, again, like Sarah, I don't recommend it. The first 6 of those years were all in my apartment in the middle of New York City. So probably might not have been the very safest thing I ever did, but I actually was fine. But anyway, I share her recommendation that you find a public place. And I had one comment, and we're starting to get questions, so I will field those to you in just a moment, Sarah. But I had one little comment I wanted to add about, you were mentioning that the groups can go really long sometimes at the end, and having, and I experienced that as well. Like some weeks, it all wraps up. Sometimes, like you mentioned, maybe there's even stalls, and the conversation might even stall. But there are definitely weeks where people are sharing, and it's really intense, and you just don't want to end. You want to keep going. I personally suggest having a culture in your group of starting the group on time at the appointed starting time, whether or not people have shown up on time. And I personally advocate ending it on time, because I think that in that moment, it feels like you don't want to stop, but then it gets late and you get tired and people get home late, and the repercussions of staying late can be difficult and can actually make it harder to keep the group going, or perhaps even just for yourself to, if you've said, okay, I'm okay with an hour commitment once a week, and it becomes a 2-hour commitment, maybe you're not okay with that. Maybe that's too much. So those are just my thoughts. Having done it, I used to always let them run late. And after a while, I realized that it was burning me out. And I realized that I needed to actually end them on time, no matter what was going on. And people can always leave the group and continue their conversations outside, or they can go get a coffee. Like, it doesn't mean that, you're cutting people off. But that was just my little 2 cents on that. Okay, great. We have some questions. So, let's see. I hope I don't know if I'm pronouncing your name right, but Feda is asking, how did you get pull free? So that's a big question.
Honestly, there's no easy answer to that. I honestly don't know. For some people, it's just a decision that today I'm not going to pull, and you don't pull. But honest to God, I do not have the magic pill or solution that I wish I did. I wish I could share that with you, but I don't. It was just something. I did a countdown. How's that? I did tracking. I didn't track how many hairs I pulled, but I did a countdown system where I did 1 day I didn't pull, 2 days I didn't pull, and I did that for a year. And my motivation at the end of the year was getting a specific gift that I wanted, which was a hockey jersey. So that was my motivation.
Yeah, I agree. Such a big, it's such an important, it's the key question, right? How do we do it? And there's many, many answers, and these problems would be so much easier if there was one answer to that question. But what we found in talking with hundreds and thousands of people with BFRBs is that there are many different paths to becoming recovered, and many different types of recovery as well. So I've also, we can both attest that it is possible in many cases, and I also have had many years now of recovery. Deb says, how do we get them talking about their BFRB, and how do you keep a person from dominating the discussion?
So that's always something that I seem to have an issue with, depending on who's attending the peer support group. There's always, the one person who wants to talk and they can relate to everything you're saying in the support group. Oh yeah, that's happened to me too. And sometimes they go off like on a huge tangent, and everybody's kind of just sitting there going, okay, they're looking at you. You have to lead the group. So that's why you're also a peer support leader. You're going to be facilitating the group. That's part of your job. What I tend to do to make people talk about their BFRBs, we'll be going over this in the next 2 sessions as well, but basically we start with a high and a low. We ask people to check in that week. So we say, if you're comfortable, because not everybody is comfortable talking about themselves. Maybe the first few times they just want to sit there and listen to other people. So usually as the facilitator, I would start by saying, hi, my name is Sarah. I'm a hair puller. This week I had a great time. I had a wedding. Something that's not so great in my life right now is I'm stressing over an exam. So we usually do a check-in, which is like 1 minute brief check-in. And oftentimes after that, there's something someone said that we jump on. So trust me, there's never a dull moment in a support group, especially for BFRBs. There's always someone, especially if they're new, who wants to ask a question, or there's something that's bugging them. So there's never, I've found that there's never quiet time, I guess, in my group.
Yeah, I would add, I don't think it's difficult to, yeah, sometimes people are shy at first, but in general, what I find is once people have the actual opportunity to talk about their BFRB with somebody, they don't want to stop sometimes, so your follow-up question of how do you prevent somebody from dominating is also important. And again, there are many tricks to dealing with a dominating person, and it sounds like the kind of topic that we will cover in much more depth, because that's a big one, especially as you're leading a group. Those kinds of interpersonal dynamics, and they can really affect whether people want to come back to the group, so they are important. And we have lots of, over the years, we've learned lots of techniques that can help. One of them, though, it just segues to this sort of, the purpose of this particular webinar today meet the sort of early stages of choosing a format and sort of just some of the logistical questions. Like Sarah, the format that we used and that TLC, we don't recommend any one format, but one that we put forward is to start with a check-in, which does mean that each person in the room will get a chance to speak unless they pass. We also have a suggested or a possible opening statement. And having an opening statement that you and maybe you take turns having some different people in the group read it at the beginning of the meeting, that can help set the ground rules for the meeting. And it helps focus you on the fact that this is a meeting about BFRBs, because we all have a whole lot of other life problems often. Sometimes they're relevant and sometimes that's not the purpose of this particular meeting. So again, having a statement that you can refer back to if you need to, remember that, we feel for you, but remember that the mission of this meeting, as we read at the beginning of the meeting, is this, and it can help ground people in why you're there. And so again, that's another tool that's on TLC's website in which we can send to all of you. It's just a helpful opening statement. So let's see. Katrina says she's a college, so says, thank you for the webinar. I'm a college student and would love to start a peer group on campus. I don't know who to ask. You're with the right people. and in fact, TLC has a really wonderful group of what we're calling the Millennial Task Force right now. And their big project this year is campus outreach. And that can include support groups. So, I mean, the basic process is very similar, except that I think actually on a college campus, you're probably at an advantage because there's a lot of built-in communication tools at colleges that you can use to spread the word about your group, and also a lot of facilities that are probably available to you if you go to the administration and need a space. That also may be actually easier, and certainly a lot of peers around, and so I think that should be really successful.
Usually, I know for Canada, it's usually disability services. So those are people who deal with not only physical but mental health issues as well. They kind of support the students in whatever aspect they need to. So I know at my university, disability services actually can spread the word, I guess, of your support group starting. They can find a location for you as well. One of our support groups, Wealth, that's been running for 3 years now, they actually run it solely on campus, and it's been really successful. There's bulletin boards around, there's residents, so there's always somebody who's looking for help.
Sure. Great, thanks. So Christy asks, she says, I'm not 100% confident with leading the group or facilitating, so would you recommend having a therapist lead the discussion?
For me, I'm not a trained professional by any means to lead a support group. It'll take some practice, definitely. But if you're not comfortable, you can definitely ask a mental health professional that you might be seeing, or you can ask if they can recommend anybody. But even bringing like your best friend to help you out, that might be something that's easier for you than finding a therapist to run a session. It does take some getting used to, and what I've been doing right now with our support group is I'm trying to have other people learn how to lead the group, so that if I'm not there, or if we're passing on the torch, so to speak, they can fill in. So it does take time and it does take practice, and I suggest even literally practicing with your friend, or you can always, do Skype with me, or I'm sure tons of people would be happy to help you out on how to run a group. But in the package we're going to send you, there's actually a format of what you can do to follow, so you're not kind of left hanging there feeling, like very shy or uncomfortable leading a group. So we're always here for you.
Absolutely. And I would just emphasize as well, you do not have to be an expert on BFRBs, except, from your own personal experience of having one, to lead a group. You shouldn't be putting yourself forward as an expert on them in terms of trying to offer therapy or even expert, knowledge. You don't have that's not the role you need to play. What you're doing is facilitating a space for people to come together and share. So you don't have to feel like you have to start out as an expert in order to undertake having a group. You're all in this together. It does take some, as Sarah was saying, it does take some attention to helping to facilitate the conversations, and so there is that role that's needed. And I agree. I started my group with others, with friends. I wound up being the person that kind of really kept it going all those years, but I wasn't alone at the beginning, and we would take turns in that kind of facilitator role, and that actually can be really helpful. I mean, again, in the next webinars we'll talk more about that, but it can help invest people in the group if they also have a role to play as part of the facilitation of the group. Then they start to own the group and feel more dedicated to coming, I think.
I think also most of what you're doing as a peer support group leader, so to speak, most of it is about the background activity. So you're setting up the meetings, you're booking the space, you're getting emails so you can keep in touch with the members. You don't necessarily have to be the leader when it comes to discussions and stuff. I mean, it's really simple. Once people get in a room and talk about their BFRBs, you'll kind of find your own flow for your own group. And it just depends, so you don't have to be a professional. I never led a support group ever in my entire life. So, I mean, it takes time and practice.
Yeah, I think you do learn as you go along, but I second that. Jennifer asks, is it necessary to have a topic chosen beforehand, or can free conversations work as well?
So for us, typically we don't have a topic for the week. Some groups love that. Sometimes it's easier to say, so yesterday we had a sport group and we said, the topic will be back to school, but nobody there was going back to school. We were all older, so we kind of discussed new beginnings. So like September's typically a time where, after summer people start again, or the new year. So we started talking about what we're looking forward to, what we can do to change our outlook on things, ways that we can self-care. So I mean, having a topic does help if you feel, especially if you're not confident, having a topic definitely will help. So there's tons that you can pick from. There's so many, but also, like Jennifer said before, once you get people in a room who've never met another person with a BFRB, you can't get us to shut up, so to speak. Like, we can talk for hours about what we've been going through because we haven't talked about it for so long. I didn't talk to somebody for 22 years, so I was like, yay, another human. So I mean, there's never a dull moment.
Deb asks, do you find that attendance is better if the meetings are held closer together versus monthly? That's a good question. You're saying that you've been having them, so my group was weekly. And I found that so I think these are good. This is, I don't have a definitive answer for you, Deb, but I did kind of feel that on some level having it frequently keeps it, on some level you might think, oh, it's too frequent, people can't make it, but it keeps it there as an option. Like, if you have to miss a month, and then like, if for some reason you have a conflict and it's only once a month and you miss that month, then you can grow quite distant from your last meeting. Like, it's 2 months since you went to a meeting. It can contribute to feeling more disconnected. So we liked the weekly format in part for that reason. But it also, as Sarah emphasized at the very beginning of this talk, it has everything to do with what works best for you as the group leader. If you are not willing to, or not interested in something that meets that frequently, then you shouldn't hold a meeting that, is that frequent, because you're going to not be happy, and you need to be happy. You need to be satisfied.
Yeah. For me, I think every other week, it seems to work really well. I think every week for me or some of our group members might be a little too much. Sometimes there's not a lot of people at the groups because, like I said, summer right now, there might be 4 people one week, but then this week we had 9 people. And then other meetings we have 25 people. It really depends. So for me, bi-weekly works. I think what we're going to try to do is now one during the weekdays and then one on a Sunday afternoon, which seems to work for most people, just to give people, some people work weekends, some people work evenings, so just to give a little bit of leeway, I guess, to everyone. We're going to try that out. I'll let you know how that works.
Dorit writes, I am a social worker, and so I am concerned about advertising my skin picking in local agencies where I have been an intern or am known.
That's fair. I mean, you don't have to give your name or you don't have to give away, just say, I'm interested in starting this group, especially if you're a social worker. That's kind of a foot in the door. You could kind of say, I have a couple of clients who are affected by this condition, and I'd love to open up this group because I know other people are affected. So you don't necessarily have to give your name or anything like that. I use my first name. I don't give my last name, although I'm sure everyone knows who I am now. But when I started, I just said Sarah, contact Sarah. If you're not comfortable with that, you can use like a different name or you can just use your initials. But you really don't have to let people know, especially if you're a social worker, you don't have to let them know. You could say it's for somebody else.
Mm-hmm. Oh, they're both good suggestions. Yeah, most of the groups that we put on our referral list, I would say that most people just use a first name. Let's see. Josette says, as a future clinician, how can I implement BFRB in a group support setting within a private practice or community mental health setting?
Okay, so two of our groups, there's one in Calgary that's run by Sebastian with the help of Brenda, who's on TLC's board of directors. He's actually a trained professional now. I think he has his master's in psychotherapy, so he actually runs the group out of his space there. I think you have an advantage if you're actually, a professional in the field because you can almost kind of ask your, I guess, agency if you can run this. This is something of interest to you. But also, I think you just have to keep the line, there's a fine line between being a professional and running a peer support group. So I'm gonna have to, I think I would ask Sebastian a little bit more about that because I'm not, I'm not a professional by any means or treating BFRBs. So that's something I could definitely ask Sebastian for you if you want to email me.
Yeah. And there are, there are quite a few groups run by clinicians. And there are a lot of clinicians also in our referral network who are themselves BFRB sufferers. And I think they do all, navigate those at the ethical ground there if in terms of revealing how much do you self-disclose about your own problems. And there's some professional guidelines, and then there's some just personally. You have to choose what your boundaries are and what makes sense to you. But let's see. Okay, next question. So Virgie writes about some very negative experiences she had with psychiatry and misdiagnosis and bad drug treatments, which unfortunately many people have experienced that with. So she is asking, do we need to have a psychiatrist or psychologist in the group? Do we need to make reference to psychiatric treatment, drugs, or psychological treatment in the meetings?
That's an iffy topic. So for us, we actually have someone in Toronto who we can say, this is a program available to people, and actually we get referrals from them to send people to our support group. I mean, it definitely helps if you can have someone you can send people to, say, I recommend this. I tend to not go into the medication discussions because I just think, we're not medical professionals. And even in our overview, I guess, of how to run a support group, we say we're not there to diagnose, we're not there to give medical advice. Like, that's just not, I mean, you could talk about what drugs you've been on, what you've tried, but giving people, dosage information, or you should try this drug and that drug, I kind of, there's a line there where I like to draw and not go over it. So, you don't necessarily need to have a psychiatrist or someone to refer people to. You're there to talk about your experiences, your personal experiences. So like I said, it's not a professional group. You're there as a peer person, someone who also has the same condition.
Yeah, exactly. And if your group needs referrals, I mean, unfortunately, there's not enough of them, but TLC's website has referrals to treatment providers of various different kinds. So again, you can steer people to resources without feeling like, you definitely don't need to be affiliated with any kind of therapist, doctor, or anything. Um, and in a group treatment, I would just say naturally people are going to share some of their treatment experiences. So those topics of treatment
They
are
do come up.
and again, knowing like there's TLC has, and I'm sure CBSN also like has like a booklet which is the current best practices for treatment, the just a very short summary, not in depth, but the guidelines. And so again, that can be shared, those kinds of resources can be shared, or you can just steer people to trustworthy
Websites, yeah.
websites like CBSN and TLC for resources. So again, you don't have to be the expert, you don't have to be and shouldn't be, giving out treatment advice. So, um, well, that we are at the end of our time, and trying to not be hypocritical and actually end on time, as I just so strongly advocated for. We will do that, but luckily we have 2 more sessions. So if there's so much more to talk about, this is such a meaty topic, support group, so luckily we'll continue to dive into it. And also, as Sarah mentioned earlier, we have just created a closed private Facebook discussion group. So just either email Sarah or email kelly@trich.org if you want to join that group, and we can facilitate that. And for anybody in this group who is actually ready to actually start their group or is currently the leader of a support group, TLC also has monthly web, video web calls for current support group leaders or people who are truly in the process of starting their group. So not sort of talking about whether they should, but really getting into the meat of running the group. And again, if you email kelly@trich.org, that's another resource that can help you. And let's see, I think we have Sarah's information is right here on the screen as well. So that you have that if you want to write and make use of that, or if you have questions. And I just encourage you to come again to the next session, and we'll send out the information about it soon, and as well as the supportive materials that Sarah mentioned. And I thank you so much, and we leave you with strong encouragement and enthusiasm for the concept of support groups, and hope that you'll continue your thinking about this. Thank you. And thank you, Sarah.
Thank you, everyone.
Thanks
Thank you.
so much. Okay, good night.
Good night.